everyone. We are Group 2 of the Riverside San Bernardino Future Physician Leaders Program, and today we will be addressing emergency healthcare. So my name is Sanam, and I will be a rising senior at Hillcrest High School, and today we have myself along with 3 of our other team members who will be presenting today.
Hi everyone, my name is Audrey Choi and I'm an incoming freshman and biology major at UC Riverside.
Hello everyone, my name is Ryan Lowe. I'm an incoming freshman at UC Riverside as well.
Hi, I'm Ali Allo and I'm an upcoming 4th year neuroscience major at UCR.
This is just a disclaimer that our presentation is in no way meant to replace the advice of a medical professional. Our aim is to increase community health by providing education and resources. But if you are experiencing any of the symptoms that we present today, please seek medical attention immediately. And we are also part of the Future Physician Leaders Program at the UCR School of Medicine, which is a summer program for pre-health students to engage with the community and present a project on a prevalent health topic. Our goal is to improve community health and access to healthcare resources. So here are the links to our pre-survey. You are in no way obligated to take this survey, but we would greatly appreciate and encourage you to participate. The feedback that we receive on these surveys will allow us to better our presentation and analyze data that we will use to carry out our project and further research. And if you do complete the pre-survey, please complete the post-survey at the end of the presentation as well, so that we may use the data, and please be sure to use the same name as well. You can pause this video and scan the QR codes to complete the survey, or you can find the links in the description. So today we will be discussing discrimination and overcrowding in the emergency room. We will also discuss emergency room visits and care for cuts or lacerations, chest pain, and traumatic brain injury. To end off with, we will provide with some Riverside and San Bernardino resources. So here we have a quick activity. How many emergency room visits are there each year? And you can feel free to pause the video and take a quick guess. So the average number of emergency room visits in the United States is about 130 million annually. And this is the average number of patients seen each year. And it really does emphasize the importance of knowing when to go to the emergency room and how to navigate the healthcare system. And this number also shows how important discrimination and overcrowding in the emergency room is, and how it can lead to even more harm and obstacles to the health of minorities. Next, I will be going over possible barriers and discrimination that some individuals face when seeking medical attention. So here are some possible emergency room stigmas and barriers, and certain individuals do face these barriers that must be overcome in order to receive healthcare, and this can include health insurance access, cultural and societal norms, which these can be people that avoid healthcare due to cultural beliefs or doctors failing to practice cultural competency, and also language barriers. There's also the fear of COVID-19, and not having access to health insurance can cause overcrowding in the emergency room, especially for minorities, since the emergency room is the only place that people know they are guaranteed health care. However, this can lead to discrimination towards people in the emergency room because healthcare staff need to prioritize urgent patients. So essentially, many individuals seeking primary care in the ER are turned away and are unable to receive the care that they need. And all of these can lead to discrimination, which I will discuss in the next slide. So what is discrimination? Discrimination is basically differentiating treatment of an individual based on their actual or perceived characteristics. And this is a well-documented health challenge, and we have seen increased reports among racial minorities, and that there could also be systemic barriers that block certain groups from receiving health care, which can be very harmful. So in healthcare settings, 1 in 5 people are discriminated against. About 12.4% of visits result in hospital admissions, and 50% of emergency rooms in the United States are overcrowded. And these statistics provide insight into why we need to work harder in educating our community in health literacy. Further, we will discuss three common reasons for emergency room visits, which include cuts, chest pain, and traumatic brain injury. And I will be handing it over to my colleague, Ryan, to talk about cuts.
Yeah, so every year in the United States, 9 million people are sent to emergency departments across the country for cuts. So a cut or laceration is defined as a deep break in the skin, while a laceration is similar and essentially is a cut associated with a torn or jagged wound. Both cuts and lacerations can be caused by sharp objects that result in blunt force trauma. And as you can see here, we often see accidents occurring in workplaces where there are lots of hazards, and this also includes construction zones and unguarded machinery. This is where cuts and lacerations commonly take place. So a risk factor is basically anything that makes someone more prone to something. Risk factor for cuts include lack of awareness, a disregard for safety, and accidents. So in order to combat these issues, you can actively inspect your workplace or any environment that you're working or playing in for potentially dangerous hazards like dangerous machinery or broken glass to help cut back on the risk of accidentally getting cut. Another good practice that is recommended for not just cuts, but a lot of other medical problems as well, is to carry a first aid kit wherever you go, in your car, in your backpack, so that you can treat any minor injuries on the spot. In the next slide, we'll basically go over some basic first aid for cuts. Okay, so basic first aid for cuts is actually really simple. Follow along with this graphic here. The first step is to always stop the bleeding by applying light pressure with a clean towel or anything you may have on hand. Then you can also help stop the bleeding by raising your limb above the heart. It's a good way for you to reduce that bleeding. In addition, you can also clean your wound with soap and water to avoid infections, arguably the most important step. And then from there, if you can, apply antibiotic cream to help further protect against infection. And then lastly, you want to bandage the wound. And while this is basically going to be good for the majority of cuts, which are relatively minor and can be treated at home with first aid, we're actually going to have to talk about what happens when you are one of those 9 million people who has to get sent to the ER each year for cuts. So if you cut yourself or you have a laceration and there is exposed muscle or bone, there are signs of infection, right? Like if you have a fever, if you have a general feeling of uneasiness afterwards, if there's a heavy amount of bleeding, or if your doctor has told you or that you know that you have a pre-existing medical condition that a cut can make worse, you should visit the ER. It's important to understand that you do not heed these warnings, right? You don't pay attention to them, and you don't get treated for a wound, for a cut or laceration that is very, very serious. Well, you could get an infection, right? You can lose feeling or function in a limb that you got cut in, and not to mention you could be in extreme pain, and we don't really want that. Don't worry though, at the end of our presentation, we'll be providing you resources that you can take advantage of so that you can gain adequate care and make sure that the cuts stay minor, and when they do, hopefully not, well, if they do become severe, you'll get the adequate care that you need. Next, I'll be passing it over to Audrey to go over the next reason for ER visits.
Thank you, Ryan and Sanam, for that very interesting and helpful information. This is Audrey speaking, and I'm so glad that you're watching our video, and we hope to leave you with some knowledge that you can one day apply. For the next few slides, I will talk a little bit about chest pain as a reason to go to the ER. Chest pain is a very relevant issue as 20 to 40% of people are affected by chest pain, and there are over 8 million US emergency room visits annually due to chest pain. Here are some symptoms and locations of chest pain. You may experience symptoms such as lightheadedness, pain in the upper body, discomfort in the chest, shortness of breath, nausea, cold sweat, or body ache. Call 911 or visit the ER immediately if chest pain is prolonged, severe, or accompanied by any of the following symptoms: confusion or disorientation, difficulty breathing, very low blood pressure, a very slow or fast heart rate, or pain spreading to the jaw, left arm, or back, which may be signs of a heart attack. Some risk factors for chest pain include being over 40 years old, obesity, smoking, and diabetes. Here are some common causes of chest pain. The leading cause of chest pain, accounting for 31% of cases, is angina, or acute coronary syndrome, which is caused by a blockage in heart arteries. Next, acid reflux, or GERD, accounts for 30% of cases. Other causes of chest pain may include anxiety or musculoskeletal issues, meaning muscle or bone issues. Some ways that you can prevent chest pain are to quit smoking and drinking alcohol, exercise within your capabilities, and to follow a balanced and varied diet. Treatments for chest pain depend on the cause of pain. Be sure to contact your primary healthcare provider or consult a health professional before proceeding to get any treatments or take any medication. If you have a history of chest pain or know that you have coronary heart disease, your healthcare provider may prescribe nitroglycerin, which helps reduce chest pain. If a person is having a heart attack, a number of treatments and tests will be performed. You can learn more about these treatments and tests in a reference page at the end of the presentation and website link at the end in the description box below. Now I'll be handing it off to Ali to talk about traumatic brain injury.
Thank you, Audrey. Hi, everyone. This is Ali speaking. The third common cause of emergency room visits that we wanted to address are traumatic brain injuries, commonly abbreviated as TBI. On average, 1.5 to 2 million Americans suffer from TBI yearly and account for 1.4 million hospitalizations. Over the span of nearly 10 years, from 2005 to 2014, California saw an increase in TBI patients of about 50,000 individuals. Zooming in on our county of Riverside, between 2005 to 2007, approximately 4,000 Riverside County residents were admitted to hospitals for a TBI, which further emphasizes the importance of educating our community on TBIs and preventative measures. So let's take a look at the next slide. A traumatic brain injury is defined as a temporary or permanent alteration of brain function caused by an external blow or force. If you look at the little cartoon that we have on the screen, there are two kids playing baseball and one's getting hit by the baseball bat. This would be an example of what could be a very damaging blow to the head, depending on how hard our kid is getting hit. Traumatic brain injuries are scaled based on severity, and there are a multitude of causes for a TBI, which can be related to age, gender, race, and geographic location. For our older folks, many TBIs are related to falls. The leading cause of TBI diagnoses in children under the age of 15 is unintentional blunt trauma. So this would be like the baseball bat example that we looked at earlier. During 2005 to 2007, the main culprit of TBIs for our Riverside County residents were car accidents, which continues to be a leading cause of TBIs overall. A car accident can actually be an example of blunt impact, so maybe someone hitting their head against the dashboard, as well as an accelerating, decelerating force, which you can see in the cartoon on the right. That rapid movement of the head could cause the brain tissue to shift into different compartments and lead to symptoms associated with TBIs, just as other causes would, which is what we'll see on the next slide. So there are four kinds of umbrella categories of symptoms that result from a traumatic brain injury. Our first category is sleep disturbances. So this could mean someone suffering from a TBI is sleeping a lot more than usual, sleeping less than normal, or having a hard time falling asleep. And this symptom was actually observed in soldiers who had fought in World War I, most likely due to blast waves or explosions causing damage to the hypothalamus. Our next category is cognition, including difficulty thinking clearly or concentrating, having a hard time remembering or feeling off. The physical symptoms refer to things like headaches, nausea and vomiting, balance problems, sensitivity to light and or noise, or lack of energy. And lastly, emotional functioning symptoms could include irritability, sadness, anxiety, and in the long term, changes in personality. If you are experiencing any of these symptoms, please seek medical care immediately. Depending on the severity of the injury, treatments can range from being prescribed anxiety medications to surgery and rehabilitation. While brain injuries can be life-altering to patients and their families, the good news is that most TBIs can be prevented, which is what we'll see on the next slide. We briefly talked about risk risk factors associated with causes earlier, so prevention would be targeted towards each age group, and the CDC actually has a comprehensive guide that is shared on our website, which you can find the link to in the description or at the end of our presentation. Some of these preventative measures include strength and balance exercises for our older folks, wearing required helmets and gear during sports games, and buckling up every time you enter the car. The Brain Injury Association of California also has an online library of resources to take a look at, including support groups for brain injuries, how to deal with medical insurance denials, which is what we briefly touched on in the beginning of our presentation, as well as safety tips, and that will also be linked in our website as well. So next, I'll be passing it back to Sanam to go over even more accessible resources that are available to our community.
Thank you, Ali. So hello everyone again, this is Sanam, and here are a couple of community resources provided. The Riverside Free Clinic, San Bernardino Free Clinic, and the 211 San Bernardino Center are all available and beneficial resources. No insurance is required for the free clinics, and if you are lacking any resources necessary for your health, contact 211 San Bernardino. So, just as a reminder, you are in no way obligated to take this survey, but we would greatly appreciate your participation. If you did complete the pre-survey, please complete the post-survey as well so that we can use the data. And please be sure to use the same name as well. You can fill out the survey in your respective language, and you can scan the QR codes and pause the video or find the links in our description. As you can see on the screen, we have our Instagram at r.emergency, our website, and our flyer. So please feel free to utilize these sources for more information about us. And we will have these links in our description as well. So please be sure to check our sources out. So that marks the end of our presentation. We'd like to thank you all for the opportunity to present to everyone, whoever's watching the video. And we would also like to thank you guys for participating in the surveys. And one last thank you to Future Physician Leaders Program with Esmeralda, Jackie, and Naomi. And you can drop questions in the comments. We would appreciate those. Thank you.